Thank you for having me here. Uh, so we'll be talking on breast aesthetic surgeries, and as you would know that it's a field which should only be done by a well qualified plastic surgeon who has detailed understanding of these procedures. And in the next 15 minutes, I'll try and explain you that it's much more than as simple as we usually understand. Especially breast implant is usually considered as we just make a pocket and put in a ball inside, but it's much more detailed and scientific than this. So what are breast cosmetic surgeries? It's a big gamut of procedures including breast augmentation, breast lift, which is a mastopexy, a breast reduction surgery, or sometimes it can be a combination of these. A very different combination can be reducing the breast as well as augmenting the upper pole. So patient would want one-sided reduction but augmentation at certain parts. So the combination is actually most of the time patient would need, especially if they have a huge breast, it's sagging, it needs a lift as well as reduction. So there are multiple combinations which has to individualize it depending upon the patient indication. So typically when we talk about breast augmentation, we have moved on from a very unnatural looking ball like, when I was young in school, I used to watch Baywatch, so I'm sure everybody would have watched. Now nobody makes breasts like this. Breast should have a gentle upper pore fullness, a nice curve so that it looks like a teardrop shape, a nice cleavage, and everybody should deserve a breast like that, and nobody should know they've had a breast augmentation. You see, if it shows that you have had a surgery, even to your partner, even if it feels that you have had a surgery, even to your partner, the game is wrong. Okay? The scar should never be visible. It should have a gentle pole without side boobs. So when we talk about breast augmentation, some women will get a big breast and big breast implants. So it's duty for your surgeon to measure and design the procedure in such a manner that even if you get a big breast, your breasts are not popping out of the bra on the sides. So these small things has to be discussed with the patient. Now in this patient, if you see, she also had widely placed breasts. There was huge gap between the two breasts, and she did not have a cleavage. Now even if you put an implant, now implant can only be placed behind the breast tissue. It cannot be put under the skin. It has to be covered by a breast tissue. So if the breasts are wide and you put implants, the breasts will still be wide and bigger, which will look further awkward. So you have to do cleavage designing. So in this case, what we did was, along with breast implants, we also put in some fat in her cleavage, so she gets a narrow cleavage, which looks very nice and aesthetic. Now another patient, I'm showing you different patients with different goals. Now every woman would have their different expectations. She wanted a very high upper pole fullness, and accordingly we had to design the procedure according to her needs. This is a married woman, mommy makeover, deflated breasts. One has to differentiate between what is a deflated breast and a sagging breast. Many women would have their breasts sagging after the pregnancies or breastfeeding, but some women would have just deflation. So she had deflated breasts, and we did breast augmentation. Of course, we also did her abdominoplasty and a liposuction, and you can see a nice level and a groove from the cleavage going up to the navel, which is called as a champagne groove. So all these things can be designed in the surgery if a person wants, and if the plastic surgeon knows this. The aim is that in every patient it should assume a very natural slope. So there are different planes in which breast implant can be placed, either subfacial or a dual plane. We don't do submuscular completely now, it's dual plane. What happens is, when we put a dual plane, basically the implant is covered with the breast in the upper pole and not in the lower pole. So an muscle presses the implant in the upper pole, so it gives you a very natural shape. It's a challenging operation because one has to be consistent in the result. And in this digital age, any unhappy patient can hamper and can be a costly affair with reputation and practice. We have to understand what the sizes are. There are different kind of sizing, the volume of implant, what is the cup size which the patient wants. Now I can tell you and I can bet you that 95% of the women in our country, including doctors, including plastic surgeons till they are trained, do not know how to buy a bra. What is a cup size? What is the numerical measurement means? What is the alphabet measurement means? I'll just explain it to you. The numerical measurement means the chest band size beneath the breast, around the inframammary line. And A, B, C alphabet just tells you about the breast volume. So whether we do a breast augmentation or a breast reduction, we are just changing the alphabet. You getting me? You can't change the numerical. Now, but many times when a patient comes to us, they say, Doc, I'm 32, I want 36. Of course, you can't do that, right? So basically, they want B cup to D cup, but they don't know what to say and how to interpret these things. Then you also have to understand what is their nipple areolar complex size, whether she wants to change or not, and then symmetry. Now, I tell all my patients that two breasts are in any woman in this world is not identical. They are like sisters but not twins, right? So you have to explain it to them before the surgery that what is symmetry, what is the part which is asymmetrical, and what you can improve and what you cannot. So again, in every patient you want a gentle slope, a very natural looking result. So how do you go about this? These are some results. Understand, it is a procedure in which you have to put an implant. It's like wearing a glove. So you have to define the glove and construct a hand or an implant in your mind to design that surgery for that patient and explain to the patient, and she should expect the same thing. Meeting the expectation is one of the most difficult thing in this surgery. So the procedure has to be predictable. So there are different things in defining the glove. You have to understand what is the nipple position. If their nipples are pointing outward, you have to tell the patient that they still may keep pointing outward. They can't come in midline, right? If their intermammary distance is wide, as in this patient, if you do not do cleavage designing, it will keep being wide. If the NSC diameter is more, it will still be more. All these things needs to be told to the patient. If they want certain things different, it can be done, but these all things needs to be pointed out. And then there is an IMF distance and base diameter which is measured. So these are different charts, different kinds of implants which comes. Not every clinic will have all these kinds of implants. We have all the inventory. We have 100 implants in our inventory so that we don't need to compromise upon what patient needs and desires. There are different measurements, but I'll quickly go into what our standard protocol is and how do we do it. Other than measurements which everyone does, we also do something called as 3D simulation. So there is a software through which we take different angles and pictures of the patient, and it creates a 3D image.
I have put on your image 240cc.
And she can actually be shown what different sizes of implant will look like on her. Now what this helps is her and her partner to decide whether they like that kind of implant. So if they want to go bigger, basically you are involving the patient in the decision making so that the results are predictable and she is happy. It helps us define what our asymmetry in our breast are in different angles. It's actually very fun to do because you can see different sizes. This software is very nice, and of course it's expensive, but you can make them wear different clothes on the software so that they can see how they are going to look in different dresses. You can assess the volume, what different volumes are going to do, and you can have multiple volumes on them and then decide. So, and you can also see a 4D animation, how this is going to look when they're jogging, when they're running and all. So, and then we actually do the surgery, we all make videos of the patient pre and post-op depending upon how they want and whether they have become a predictable results. They've got predictable results. So this has helped our practice, and we have more than 99% predictability with the results after using this management software and techniques. So another example. So this patient came to us, see her pre-op on the left. She said, Doc, I don't have upper pole fullness, I don't have cleavage, my breast implants which I've had already few years back is small somewhere else. I want a bigger breast implant. Now the point is, when we did the assessment and planning, we actually reduced the size of implant which she had, but we did cleavage designing and we shifted her inframammary pole a slightly higher up. I'll show you her side views and you will understand what we did for her. This is what her pre-op was on the left. If you see, the distance between the nipple to the IMF was too much. It was bottoming out, there was glanduloptosis. So we had to correct that and shift the implant slightly higher up on the chest. even though we reduce the size of implant, along with cleavage designing, you can see what different shape you can get. Now, you would say that even the left side was good, but that's the beauty of cosmetic surgery. We are going from good to much better and excellent. So, same patient. And if you're wondering where is the scar, scar is inframemory, around 2.5 to 3 centimeter scar, which is hardly visible because it is on the undersurface of the breast. And the best part about it is, as in your phalangeal incision which you give during cesarean, this area is blessed to have good scars. You know. Now, coming to mastopexy or reduction mammoplasty, it needs a huge amount of understanding. And first of all, big breasts are not only socially embarrassing, it restricts choice of clothes in women, but it also adds to the shoulder and neck pain. A lot of women come to us, you know, they look stoopy. It is causing a huge amount of pain. A lot of women these days want to wear dresses which are braless, and a sagging big breast they simply can't. So all these things has to be understood, and it has to be understood with clinical measurements, like what are the volume changes, what is the level of nipple areolar complex ptosis, glandular ptosis, and all these things. There are different techniques depending upon what incision you make and what scar you make, and how do you define the pedicle so that you lift the nipple areolar complex up, preserving the lactation potential and the sensory supply of the nipple areolar complex, which is very important. So, showing you some of our results. Of course, we did her body contouring as well, and you can see how breast can be lifted. She wanted a very natural looking result, and that's what she got. Another patient, you can see her upper pole fullness was improved. In this, there was no upper pole fullness was created because she did not want that. In this, the upper pole fullness was created by a technique of called as auto augmentation, in which we use the pedicle in such a manner so that she gets a nice upper pole fullness and cleavage. Another patient, a huge reduction of around 600 grams, or around 1.2, 1.1 kgs reduced from the shoulder. You can imagine. Another patient with body contouring. You can see the breast lifted, the NSC complex which is pointing down towards the floor has got lifted up. Another patient, a nice cleavage. Another mommy makeover with good breast reduction, natural looking result. And these are the lines which we're talking about, which looks very aesthetic. So if they are not twins and they are like stepsisters, what you can do, so we did different techniques to assume a much more symmetrical result. A huge breast reduction, around 3 kgs reduced from her shoulders. Now earlier these patients will, most of the surgeons would do a reduction in breast, but they'll not look aesthetic. If you see, her upper pole was very narrow, her lower pole was huge. So we had to make it into proportion so that it looks like a normal looking breast. Another patient, more than 4 kgs reduction on the neck. You can imagine what kind of relief she would have got. Another auto augmentation, mastopexy. You see, this is what I was talking about. Breasts which are saggy, now women would like to wear clothes which do not need bra. They can't simply wear it if the breasts are like these. With our surgery, we can actually design the breast in such a manner that they can go braless. So another auto augmentation, mastopexy, you can imagine what lift you can achieve with this surgery. And this is the scar. After a year, these are typical of our patients, that the scar really fades nicely. If done properly, if the patient follows the scar management protocols, the scar really fades nicely. Another auto augmentation, mastopexy. If you can see the result, the upper pole fullness and the cleavage and the scar. The scar is bang in front of the breast. If you can appreciate, it's like a vertical line, but it's hardly visible. And that's the key of doing a beautiful surgery. This is again a stepsister breast. One breast really small, one breast ptotic. It has not developed as she grew up, and this needed an augmentation mastopexy, which is totally different. So see, this is implant along with lift. So at one side we add implant, which can help add the weight and breast can sag, but we also did a lift so that she gets a result what she desired. So a lot of our patients keep sharing these pictures with us. These are all braless pictures of different patients. Some had breast lift, some had breast implants, some had breast reductions. So this is what we can achieve in breast aesthetic surgery. One point of caution, sometimes people think that it's very easy. She's one of the gynecologists who was operated by a gynecologist, converted to a surgeon, converted to a breast surgeon. I don't know what this field is, breast surgery. There is no specialty about it, which till when I was in middle school, right? So anyways, what she had, what a bad scar, nipple areola complex high up, breast down up. one of the most difficult problem in breast aesthetic surgery to correct. And you can imagine what situation she was in. So this is what you can do to correct this. The point is, choose your surgeon. We cannot be experts in every field, but we can know how to pick up an expert. Thank you.